A very good morning, everyone. I welcome all of you, and most importantly, our special guest for today, Dr. Himanshu Gupta, on behalf of Woodridge High. I'm glad to have with us our chairman, Deepak Kothari sir, our founder director, Samantha Kothari ma'am, and our vice principal, Yogesh Brahmapurikar sir. Thank you for joining with us. I acknowledge the presence of our director of secondary and senior secondary, Sandeep Malu sir, and request him to take the welcome address.
Thank you, Mitansh. A very good morning to everyone. Hearty welcome, Dr. Himanshu Gupta. Students and teachers, Dr. Himanshu Gupta can aptly be described as the COVID protector or the Messiah of Aurangabad and Marathwada region. Administration of a 200-bedded hospital, a multi-speciality hospital, which has an average occupancy of 85%, is indeed a Herculean task. Students, how many doctors do we come across in our lives who go ahead to do their post-graduation in healthcare management from the IIMs? We are indeed privileged to have Dr. Gupta with us today. He's an exceptional leader, an astute administrator, eloquent speaker that we all will witness in the next hour right now, laudable learner, in spite of having completed his medical as well as management courses from the premier institutes of the country. Can you believe he's pursuing his law in spite of being such a successful professional with a hectic schedule? I believe in his multifarious roles, he manages to give a 48 hours productive output in a 24 hours day. Why this session? Students and teachers, we all have been hearing time and again, and I think schools and students have been, kind of a prey to the overall ongoing circumstances because we've been out of school for more than 1.5 years now. We're talking of the third wave coming up. We're talking all across about the vaccines for the students. That anxiety is prevalent amongst the students. The board examinations for grade 10 and 12th, the term 1 is coming up in November, December, which is going to be a crucial phase the next couple of months in terms of preparation. All your queries of the students and parents would be very vividly covered in his expressions today by Dr. Gupta. Dr. Himanshu sir, it is a blessing to have you, and I welcome you on behalf of the entire Woodridge fraternity. Over to you, Mitansh.
Thank you so much, sir. I request Ishita to take up the introduction of our special guest, Himanshu Gupta sir, today.
Dr. Himanshu Gupta is the Director Administration for St. Nandlal Dooth Hospital. As we all know, Dooth Hospital has been at the forefront in the treatment of COVID patients since the start of this pandemic. Dooth Hospital, under Dr. Gupta's leadership, has treated more than 15,000 patients on site and more than 2,500 patients virtually through teleconsultation. He is a member of the Aurangabad District COVID Task Force. It is a distinct honor for the students and staff of Woodridge High to have your esteemed presence, sir. He was trained by WHO in March 2020 for country preparedness for COVID pandemic. His professional qualifications and quench for excellence is evident from his awe-experiencing journey. He is a graduate in dentistry from Marathwada University, Aurangabad, and postgraduate in healthcare management from Symbiosis International University, Indian School of Business, and IIM Ahmedabad. He is also holding post-graduation in emergency medical services and medico-legal sciences. Currently, he is pursuing law from MP Law College, Aurangabad. He is the president of Marathwada Hospital Association, executive director of Maharashtra Village Transformation Foundation, secretary of Lions Services Medical Trust, secretary of the Dentists Association of Aurangabad, past president of the Indian Dental Association, and is associated with multiple professional organizations around the globe as American Dental Association, Indian Dental Association, American College of Healthcare Executives, and Lions International. He has successively contributed to bring revolution in the way healthcare is perceived in the Marathwada region. He has created a highly sustainable network of primary, secondary, and tertiary healthcare centers. Through his designation and the president of Marathwada Hospital Association, he has initiated multiple health initiatives such as organ donation camps, dialysis camps, COVID vaccination camps. Dr. Gupta is extremely passionate about dentistry and is credited for launching oralcare.co.in, India's most advanced dental and oral healthcare facility in Aurangabad. Let me humbly invite Dr. Himanshu Gupta to share with us a few words before we go ahead with our question answer session with him, to be conducted by our teachers Radhika Mahajan ma'am and Krushila Krishisagar ma'am.
So thank you so very much, Mitanj, Sandeep ji, and my special thanks to Deepak Bhaiya and Samantha ji. And of course, Ishita, you have given almost everything, whatever is there as a need for introduction. Thank you so very much for this interactive session organized by Woodridge today. And it's indeed my pleasure that I'm interacting with the youngsters, which I was missing since last 2 years at least. You all are great, and you are staying home, but giving maximum to revive your own passion and maintaining your own stream of happiness by doing various activities. It's not easy to stay back at home for so long time, and this standing life, and I'm sure each one of you is healthy, and I'm sure that your family members are doing good, you are keeping good, and your teachers, your staff, the various stakeholders in your life are keeping their pace good. So once again, I thank each one of you for having this session today, and I'll try my best to share whatever is possible today. And I'm always a learner. I always have a passion to learn, and learning from your age group is the best learning I can say. The way the youngsters are doing today is phenomenal. They have their own ways, and if the parents are there on board, then I'll be very vocal to say that let them live the way they want to live. And पेरेंट्स ने ये नहीं सोचना चाहिए कि बच्चे 2 साल से कुछ ज़्यादा नहीं पढ़ाई कर पा रहे हैं तो क्या होगा. उनको जैसे जीना है जीने दीजिए. अगर आप डॉक्टर नहीं बन पाए हैं, इसलिए अपने बच्चों को डॉक्टर मत बनाइए. उनको इतना मजबूत बनाइए कि वह हॉस्पिटल बना के डॉक्टर्स के साथ में रह सके. अगर आप इंजीनियर नहीं बन सके हैं, तो आप इंजीनियर बनने के लिए जोर मत दीजिए. उनको उनकी तरह से आगे बढ़ने दीजिए. हो सकता है आगे चलकर वो इतनी फैक्ट्रीज खोल लें कि इंजीनियर्स ही इंजीनियर्स रहे. सो लेट देम लिव द वे दे वांट टू लिव. लेट देम help them or support them or guide them with best of our available resources. Let them keep aware that what nature holds for us, what society holds for us, what country holds for us. I am sure they will shape up much better than what we expect out of them. So certainly this was the time from March 2020 till today that by force of nature, we all are back home. And when we are back home, we have a lot of things to do. This time will not come again. in positive sense as well and in negative sense as well. When I say positive sense, probably if you are from this standard 9 to 12, you won't be staying home for 2 years in next 10 years of your life. And thereafter, probably not. So you have got the best time to stay with your parents, to stay with your grandparents, to stay with your family. And in negative sense, this COVID pandemic is not going to come again. So both ways, we should take this advantage of togetherness, advantage of happiness, advantage of getting connected. Though we are distant, but we are staying connected. I'm staying connected with you today right now, though I'm not with you. So this is how the connectivity should stabilize in our life. We should value the resources available, because we have realized that how the lockdown was forced to us, not by compulsion, but there was no other way. So that was the only option available. So this has given us altogether a new understanding, and I'm sure that each one of us has got some or the other ability, some or the other special quality, which can not only give best to our home or our family, can give best to our society, best to our community, and best to our country. We have seen how India has taken a big leap during past 20 months. So we as Indians have a lot of things to do here onwards. Let us stay focused. Let us stay connected. Let us stay safe so that we can take ourselves to next level.
Thank you so much, sir, for your valuable guidance. I hope your guidance is going to help all the students, parents, and teachers to tackle with the condition that we are facing now. I request you, sir, Dr. Himanshu Gupta, sir, to kindly guide us with a few questions that were asked by students and parents.
Sure.
First question is, are we really expecting a third wave around October? And related to the same question, the age group of individuals infected in first wave and the second wave were different. Is the third wave going to infect maximum individuals in young age group?
So if we just see the journey of COVID pandemic from February 2020 till date, the peak of first stage was maximum 65 to 70,000 patients per day. And if we see the second wave, the peak of second wave was close to 4 lakh patients per day. Now, the day second wave started diminishing, the current trend is 40 to 50,000 patients per day today also. So it is quite close to the numbers what was there during first wave. So what I say is third wave is already going on. If you see the span, the first wave was close to 4.5 months. The second wave was very speedy. It was for close to 3 months. But thereafter, it is continuous. So if the number is maximum 4 lakh for 3 to 6 days, and the number is 40 to 50,000 every day since 3 months, the quantum of people affected is much larger than what was there in first and second wave. So third wave is going on. Probably from pandemic, we are moving towards endemic, where COVID is going to be the part for quite some time. And age group affected is every person, no matter it's a child, adult, or old age group, all have been affected by COVID. During first wave also, there were kids who got affected. In second wave, the number got increased because the infectivity was very, very high. And in third wave also, we are getting few kids regularly with some or the other symptoms of COVID infection. So let us not take it that, we have to wait for third wave. It is already going on. It's the way we want to protect ourselves. It's the way we want to safeguard ourselves and counter the ongoing wave. Let us not keep it as a labeling of the wave as third wave. The wave which is there after second wave is by default a third wave which is going on.
Thank you so much, sir. I hope the doubt related to the first, second, and third wave and the infectivity age groups is clear to everyone. Second question is, when will the COVID vaccine be available for the individuals above 18 years of age?
Above 18?
Above 18 years of age.
Below 18.
Yes, below 18. Sorry.
Below 18, yeah, because above 18, the vaccines are already available. As far as the age group below 18 years is concerned, almost everywhere in the world, there are developments which are going on. To be precise, vaccine development is not that easy and straightforward procedure. And it needs a lot of commitment from the developing team, from the governments, and then the implementation team. So implementation is done directly by injecting the vaccine into the body of the human being. So none of the government is willing to take that risk unless the efficacy and efficiency of the vaccine is proven in the adult age group. Now, whatever comes as a side effect or the complication of vaccine research, governments don't want to take the young age group as their trials. So because of that, whatever developments are happening globally, unless they are safe, they will not recommend it for the age group of below 18 years. In Western countries like UK, US, there have been a good amount of trials and they have fair response to what we are listening and observing. But country like India, the age group below 18 is very different. Almost a large quantum of our population is not going for regular health checkups. They are not aware of their current medical situations. Whereas in other countries, it's a format that you have to follow to stay healthy and to be the part of beneficiaries of any health system. So there is a mandation which is allowing every family to get a regular checkup of their kids in other countries, whereas that is not a case here. And because of that, it's very difficult to understand what type of population of younger kids should be taken for this trial of vaccine. So governments are waiting that as soon there is an established vaccine program for kids, they can implement it. If we see in our country also, various developments are happening. There are companies who are coming up with single dose. There are companies who are trying for nasal spray. So we want to see that whatever comes for our kids, it should be safe, it should be fast, and should not have complications or side effects which are experienced by elder population. So development of vaccine for below 18 is already there. When to get that vaccine program rolled out for them is a question of time, which should be there sooner or later.
Thank you so much, sir. The next question is, 2 doses of vaccine for students are sufficient for prevention, or will there be a need of booster doses too?
As I said, the vaccine program for adult is having 2 doses, whereas the developments for vaccine which are considering the child age group, still the government and the developing teams want to restrict it to 1 or maybe a nasal spray. So let us not have a comparative evaluation between the vaccine dose which is going for adult population versus which is expected for the kids. Vaccine is mandatory, and there is no other effective measure to take unless we vaccinate. Only other measure which works equivalent to vaccine is your protective gears, which we'll be talking later during our question sessions. But yes, booster is always needed. Why? We are aware that so many mutations are happening to this coronavirus, and because of that, every now and then there will be some or the other additions in the combination of vaccines. And when these vaccines are developed for a specific time period, then certainly after one dose, maybe another dose for them will be there as an option. Looking into the trend of vaccination program, whatever has happened from influenza till date, it's always a stage when the such type of pandemics, when they're ending and they are termed as endemic, at least for next 2 to 3 years, there has to be a continuous effort to protect the population. So booster is always there in pipeline. And as far as we as medical workers are concerned, it's already been indicated that anytime after the month of October, we will be given the booster dose.
Thank you, sir. I hope the individuals below 18 years of age, after their vaccination starts, we will get to know about the booster doses further, what are in line.
Yes.
I request Charushila ma'am to take over further questions.
Thank you, Radhika ma'am. I hope I'm audible.
Yes.
Right. Thank you, sir. As you indicated, that single dose and nasal spray, y'all are planning, I mean, the doctors are planning to have no or less side effects. So this is quite a good information that don't believe on what kind of rumors are going on in the society. Thank you for the valuable inputs. The next question is, does COVID actually spread through surface transmissions? COVID virus does not multiply on food. It requires live human and animal host cell to multiply. But when surface transmission is discussed, it is said that coronavirus remains intact on surface for 2 to 10 days. Why is it then said that it does not spread through food but spreads through surfaces?
Okay. So this is a question which has been in debate since last 2 years, and there have been various theories to come in favor or against this surface contamination. Now, if we see coronavirus as a group, COVID-19 is one of the coronaviruses. So coronavirus as a group is getting spreaded through droplet infection. Now, droplet infections, if we see, it is more by sneezing, talking loud, or by coughing. All these actions, they are causing the droplet infection, droplet release of droplets. So when these droplets are staying onto the surfaces, and directly or indirectly, we are continuously in contact. Continuously in contact is very, very important. It is not like you are passing through a corridor and you have touched something and the virus will affect you. No. The minimum contact period, which has been indicated by CDA, CDC, and ICMR, is 15 to 20 minutes. So we all know that surface contact of an individual is not going to be 15 to 20 minutes at any point of time. Surface contact means you have touched it and you have left it. So that is not going to create any transmission unless you are in such a setting where there are thousands or maybe lakhs of droplets are already present and you are continuously touching some areas. Then there is a possibility that is also a very remote possibility, because droplet is not going to get accumulated unless you touch and then you touch your face or openings of your body. Then only the transmission cycle will get completed. Without the transmission cycle getting completed, the chances of infection is a remote possibility. That is the reason why the mechanism of protection defined by CDC or ICMR says that rub your hands with either soap water solution or hand sanitizer, so that you are not carrying the transmission from the surface through your hands to the openings of your body. And that is why the mask is becoming the most protective element, because the droplets are not allowed or not able to enter through the mask. So hand washing, hand sanitization, and wearing of mask is becoming the most potential, preventive method for the coronavirus. So in very specific words, surface infection or carrying the infection from surface to your body is of hardly any percentage. And as of now, there is no proven study which says that it is only going through surface as a carrier. And we are very clear from medical side that the transmission cycle has to be completed. If the transmission cycle is not completed, the spread of infection will not happen. And the transmission cycle completion takes not less than 20 minutes. So these are few things which are like a mathematical calculation. And we have seen that this is how it happens. And that's the reason if we see the hospitals, if we see the medical, manpower, they all have been forced to wear PPE kits and all other gadgets, so that whatever surfaces they are moving through by taking care of many patients in one ward or in ICUs and all, so that they are not carrying from one part to another part. So I hope I have cleared about the spread of infection through surface.
Right, sir. Thank you. As you said that we need, from your inputs, I could understand that we need to follow all kind of preventive measures in order to protect ourselves from the contamination of COVID-19. Next question is, how do we manage health being at home instead of going out and risking ourselves from COVID?
So we all are aware that we don't touch things which are dangerous for our lives. If any wire which is carrying current is open, we will never touch it. If we see the stream of water flow in a water body is very high, we will not jump in it. If we see the traffic is on a very high speed, we will not cross the road. So when we all are aware that these are the risky elements to follow and to risk our life, we should not bother and we should not look into more of research. Let us follow the simple rules. Protect yourself. And that protection is not only going to help you, but it's also going to give you a lot of courage that you are the part of that system which is also helping to protect the population. If today you are going in any such situation which is going to spread or capture infection, and then you are becoming a carrier, you are not only a carrier for yourself, you are coming back your home, you are carrier for your family members, you are meeting your friends, you are carrier for your friends, you are meeting a risk, high risk population like the disease population, then also you are risking yourself along with them. So the 3 C's what have been recommended to stay away is crowded places. If you want to go outside, you have to avoid crowded places, maintaining a safe distance. Why this safe distance has always been a part of consideration during COVID pandemic is again related to spread of droplets. It's been measured that once you are sneezing or you are coughing, the droplets are going to close to 6 feet and then they are going onto the ground surface. So if you are during that range of 6 feet, you will find that you are more prone to catch infection. That's the reason why the safe distance has been advocated time and again. Then we should avoid close contact settings. Students sitting next to each other was a routine before COVID pandemic, but now it's not indicated. So I'm again relating it to the under 18 age group. They are not vaccinated, but their schools have been closed. Why? For the simple reason that close contact settings have to be avoided. If the students are sitting next to each other, the distance will not be a space of 6 feet. It is not possible in a class of 50 to have a distance of 6 feet and all around distance. So we have to avoid close contact settings as well. And last C is confined and enclosed spaces. You are going in a lift and there are 10 people inside. You know that you cannot have the safe settings inside. So crowded places, close contact settings, and confined and enclosed places. These are the 3 C's which we have to always avoid. Now, apart from this, if you want to go out, look for a reason for what you are going. Is it going to help you a lot for completing your work? Is it mandatory for your settings of work? Or you just want to go to meet people, to greet people? So it's only the third thing which you have to avoid for a while. You can meet them online. You can talk to them on phone. I understand that it's not that easy to stay back at your home for long and then, to follow all these things. It's very easy to say, it's very easy to talk, but it's very difficult to follow. It's like young birds, they want to fly. It's the same what is happening to the young kids. They have never been in, an atmosphere where they have to stay back in home for a couple of days, couple of months. So certainly some amount of frustration is mounting up, but then let us look the brighter side. We are back home. We are able to observe, if I just take on a lighter note, they can observe mummy and papa, they observe grandparents, who is the ruler of the house, mummy or papa? They'll find that the papa figure is always a puppet. They have to listen to mother, they have to listen to grandmother, they have to listen to son, they have to listen to daughter. So this observation you will never get in your life again. Observe them. You will find, mummy, this is the most important powerhouse. It's like a mother care. It's like a mother nature. Everything is free. Oxygen free, water free, life free. Observe your mother, observe your father. You will get connected to them in a big way. So why you want to go outside? Stay home. Feel the warmth of your parents. Feel the warmth of your house. And contribute. Contribution is another lesson which has been the part of Corona. It starts with C and the Corona starts with C. So stay away. Don't contribute to the spread of Corona. Contribute to your own family. Contribute to your own community. Contribute to your own country. All C's are there in fact. But you can do the way you want. You have to be protective for yourself. You have to be protected for your community.
Definitely, sir. We'll try and follow as you indicated. That is, avoid moving in crowded places, avoid close contact, and avoid confined and enclosed places moving around in it. So it goes without saying that prevention is better than cure. Next question comes is, when will COVID come to an end and how? Will it remain as a disease like chickenpox or polio?
When COVID will end is a big question mark, but we know that by medical developments, by healthcare advantages, life is not at risk unless we push ourselves for a risky situation. During the first wave, the treatment options were not available. So the death rate was very high. During the second wave, we came out of lockdown. So we thought that everything is normal. And we took a big risk by moving here and there. And the infectivity rate was very, very high. Because of that, a large section of population was infected, though the resources were there, but they were completely drained out the moment the number started from 50,000 a day, reached 4 lakh per day. All the resources were drained out. So people suffered not because of lack of facilities. They suffered because of shortage, which happened because of sudden change in infectivity ratio. And now, when everything is going fine, we have to protect ourselves by simple methods, which we have narrated just in the last question. These methods are much more proven for prevention. These methods are easy to adopt. And these methods are now becoming habit. Since last 2 years, we are following them. So it's by default. If you are going out of your house, you'll certainly pick up your mask. It is going by default. So let us go in this by default mode for a while. And together we can conquer any bad scenario. It is not possible by a few individuals, by a community of only medical personnel, or by the government. 130 crore people living in this country, how many can be reached out in any emergency situation is a big question mark. Any healthcare settings of any country is based on the disease load of the country. These pandemics are not the part of the disease load. These are the sudden spurts. These are the sudden scenarios which have been, coming in front of us. So the only support, the only commitment, and the only cooperation what we can give to our community is by following the golden rules. And if we follow those golden rules, probably we are pushing the disease far away from us. And that is how it's going to end. If we collectively decide that we will follow these golden rules, we are pushing the disease ahead. We are not going to be the population getting affected by it. And it's been proven. There are so many small countries where there is no COVID as of now in third wave. Country like Bhutan, which is just next to our country, we'll find that the number of cases has dropped down even to 10 in a day or in a week. So this is possible. That how we can end only by coming together in terms of thoughts, not coming together in terms of crowd. If we decide that we have to follow these guidelines, we collectively can end this disease, and we can take it as a phase of endemic from here onwards.
Definitely, sir. What you said is truly very, it's very correct that we need to be close in thoughts. Hope medical development and healthcare advantages will slow down the contamination because there is no clarity up till yet that it may suddenly go off. I hand over the mic to Radhika Mahajan, ma'am.
Thank you so much, Charushila ma'am. I just hope that the golden rules, which we all know, we follow it to our maximum extent to avoid the infection further and the spread of infection, and get rid of this pandemic condition very soon. It is in our hands to control the situation what we are dealing with. Sir, my next question is, we have been hearing about Delta variant, Delta plus variant, C1.2 variant, Zika virus, Nipah virus. Are there any special causes of rapid mutations in these viruses?
Okay, so I'm not sure how many of us wants to research in this area. For me, it's only coronavirus, which is more easy to understand. and it's more, easy to take it as a consideration of medical health. These viruses are, these are the all mutations which are happening. And if we touch upon just the nature of this virus is having a envelope sort of configuration, and this envelope is getting opened again and again. And every time when it is opening, there is some change. And those changes, for the sake of understanding, have been termed as alpha, beta, delta, and all those names what have been given. But if we see the effect of it, what is going to happen if there is a spread of delta variant? The spread is same. Infectivity will be of different origin. Symptomology remains the same, because symptomology is coming from the main corona group of viruses. So whatever is going to happen more of the respiratory tract, more of for them who are with medically compromised status, and the rate of infectivity may vary from sudden spurt to a latent spurt, which is a part of medical research, and to come up with some or the other if I take it a bit more different from what we think, if I have to create some sort of fear, what I have something to say with a new finding, and making the population realize that even if you were taking good steps, the population was not protected. So now this new normal is going to be more dangerous for you. So all these variants are having a specific origin and a latent phase of infection, which is either very speedy or very slow. But ultimately, it is causing the same symptomology, which is treatable today. Understanding it more in detail will be like a medical study. And instead of that, we should focus more on the preventive methodology of all these strains, which remains the same. There is no change in our golden rules, whether the variant is alpha, whether the variant is delta, or C1, 2, whatever it is. Another is comparison, like Zika virus and all those viruses. They all are not the pandemic sort of viruses. They have area specific, like you can find more in the Brazilian countries or in that continent, which is not the case. However, with coronavirus, it's a pandemic affecting more than 173 countries. So this has a complete different nature. Important is to have a very clear understanding that these 5, 7, 10 symptoms, if are visible to you, take care, due precautions, visit your doctor early. Early is the biggest, understanding we should have in our mind. Common cold and the symptom of COVID, they are not very different. Viral infection and the symptom of COVID, they are not very different. So we should not do research on ourselves. We should straight away reach our family physician, our pediatrician, and take a valid opinion that whether I am getting affected with a common cold or I am having symptoms which are related to COVID disease. If this understanding is there, probably rest all will be of academic interest in terms of understanding the mutation part of the virus.
Thank you so much, sir. I hope these variants, Delta, Delta plus, these are specified grouped under a common heading, that is coronavirus, and they are going to infect in the same pattern and in the same way as we are hearing, that is our respiratory system. Next question is, what preventive measures can be taken for these new variants? Are they same as what we are following?
Yes, certainly. The protective measures remains the same. The more we are good at our hygiene, less are the chances to get any sort of infectivity. The more we are cautious in terms of following the given directives by ICMR and CDC, that's like wearing your mask, keeping a safe distance, avoiding crowded places, maintaining our hand sanitization. All these things are going to be the same. And you'll be surprised, they're not only saving from COVID, they're also saving from other infections which are generally there during these times. So one set of tool is protecting you from multiple diseases. And slowly and gradually, it is becoming your routine, it's becoming your habit. And this habit is going to define a newer trend of prevention, which is easy to accept, which is easy to adopt, and easy to even stay protected by a large number of infections which are possible during these change of weather, and a lot of other problems which are happening countrywide. Our intent has to be that we should be there to break the chain of events which are happening. We can easily break the chain if one person in a family is, getting affected. Isolation is one method which has come out of this COVID pandemic, which is proving great. And this has been proven for other type of common cold and cough as well. If we see, if one person is affected in our family with common cold, the chances of others getting affected is on higher side. Same is there with COVID as well. So we are not doing anything different majorly. It's only the severity which gets different medical treatment. So we should avoid any situation going from a small change into a worst situation. We should be observant of ourselves, and we should immediate approach for medical help for early treatment and early, medical help.
Thank you, sir. I hope the default habits which we have incorporated in us, like wearing a mask while going out or keeping a sanitizer with us, are surely going to help us prevent against this variants also. Next question is, your assessment of the times ahead, how long will this uncertainty go?
Okay, so if we see 2020, let us compare 2 months. If we see August 2020 and August 2021, we know that changes are happening in a positive direction. Situation is quite under control. Situation is with good developments of facilities. Situation is much higher preparedness than what was there in 2020. Even the situation is much favorable when we want to complete our daily routine, daily work, our job scenarios, and everything. So slowly and gradually, this situation is going to be normal. The more we will be protecting ourselves, the more we will be following the norms, we will be contributing to our community and our nation for better recovery on this pathway. As I said earlier, it's a responsibility of each and every citizen to get back to normal. If I try my best and remaining 10 do not, then the situation will not be possible to correct easily. So on mutual understandings, we can not only counter the current situation, we can completely redefine the new normal situation of our country. Whatever is left as an infective phase, which is in talks by the government agencies as a third wave, where I said this already going on, is more to make you realize the importance of second wave. Second wave was very dangerous. Second wave was ruthless. So we should not succumb unknowingly because of our small mistakes for another big blast. That's the reason we are always saying that the third wave is going to be there, or third wave can come as a turmoil. We need to understand the importance, and we need to stay aware for ourselves. I'm sure every one of us can contribute positively to get rid of this phase as early as possible.
Yes, sir. Thank you. It's the responsibility of each and every individual to take care of themselves also, as well as the people surrounding also. That is how we could limit the spread of such kind of infections. I hand over further questions to Charushila.
Thank you, Radhika ma'am. The next question is, how effective are the current COVID vaccines against these new variants? And how does influenza virus vaccine provides protection against COVID below 18 years?
So let me address the second half first. Below 18 years, the things are still under research, and the intent of developing a vaccine below 18 years is very, very clear, that every researcher, every community of medical origin wants to 1000% safe for the kids. So whatever is going to be the effectivity of vaccine for the young generation is certainly going to be on higher side as compared to what is received by the adults. Now, the protective mechanism of vaccine is as such, it's a live vaccine which is getting generated through various combinations, either in the human trials or in the animal trials. But whatever is coming up as a protective measure, this has been noticed widely all across the globe, that once you have taken vaccine, the threat of death is decreased by 95%. So that's a big, advantage of receiving vaccine in time. Yes, there are certain side effects which are there for a couple of days, but against those side effects, the protective addition to your body is on much higher side. And even if we see the infections which are happening after the vaccine, there is a population, there is close to 1% of population, not 1%, less than 1%, who have been affected by COVID even after first vaccine or the second dose of vaccine. But the most important observation is the threat to their life is minimized drastically. So that is another big positive move after taking vaccination. Your stay in hospital decreases by at least 70%. That means what? The virus is affecting you. Since you are vaccinated, your immunity is on higher side. So you are not going into an immunocompromised status, and your recovery mechanism works faster. So that is the biggest advantage what we have been noticing through this vaccine program, either by first dose or by second dose. So as early the family members are getting, protected by taking the vaccination, it's going to be of very good help to each one of us. Now imagine a situation. We know that most of the families today in our country are nuclear families, where there are a father and mother and one or two kids. So if father and mother have been, taken the vaccination in time, 50% of the family is protected. Remaining 50% is getting protected by preventive measures. So indirectly, we are limiting the disease in a big way. And that is how the delay in 18, the category of below 18 is not impacting the population, because large number of adults have already been pro for taking the vaccine. So through you all, the request is motivate your parents, motivate your family members, motivate the people who are working, who are your working aides, for getting them vaccinated. Government is going all out to organize vaccination drives all across the countries. There are social organizations who are giving vaccine free of cost. Those who can afford can go to the paid centers. Those who cannot afford, you can plug them to such locations where the vaccine drive is happening. So this is another contribution which, as a students, as a young leaders, we can take a call on motivating our people who are not pro-vaccine by giving them a right input about vaccine and making them, realize the importance of vaccine. Because if they stay protected, you are already protected. This is how the whole pandemic is getting addressed through the combination of prevention and vaccination.
Definitely, sir. So vaccination is of prime importance. What is very important to understand, as the threat of death definitely gets declined. Next question is, do you think after this pandemic there will be a great impact on students' learning as well as health?
Instead of health, why not to use the word well-being?
Oh.
Students are getting good amount of information from their own sources. All are highly occupied by available network. That network can be a 3G, 4G or 5G, or the personal network of their own friends. So both the networks are helping them for good amount of knowledge. They are also getting, regular online classes for their curriculum. So as far as knowledge and education is concerned, that is constant, that is happening, and that is channelized. Important is well-being. Yes, when you are not moving out of your house for a couple of hours in a day or maybe for long, there is a sort of mild to moderate frustration which is building up. And we have to cope up with that. We all are aware that this is not a situation by choice. This is a situation which has been forced upon us. And when something is not in your hands, only thing is to accept the situation, to understand the situation, and look for whatever is possible within your spread of hands. And I personally feel a lot of things are possible. You can contribute a lot. You can contribute to your own family. You can collaborate. You can collaborate with your friends. You can collaborate with your teachers. You can collaborate with your community. You can communicate. There are so many ways, the youngsters have come up, somebody is writing a poem, somebody is doing Hindi kavita, somebody is playing online games. Constructive way of handling the available time. And if we are positive, we can have multiple thoughts channelized in the same positive manner. Use the available time for best of your abilities. This is going to be a new dimension in your life. You are growing during COVID pandemic, so you know how a pandemic affects us. You have the best experience through this worst phase. So you know how to handle yourself. You know how to support your families. You know how to behave in a community. You know what is good and bad for the country. These all learnings otherwise could have been a part of training. This has come not as a choice. So look for your own well-being. You can rejuvenate yourself by following a regular regime of exercise. You can rejuvenate yourself by having a healthy discussion within your family members or your friends. You can contribute for something which is beneficial for your own society. There are so many people who are residing in small closed gate societies. You can do something which is beneficial for your dependents. That means your maidservants, their families. You can educate their kids. You can support them by whatever possible from your side. Not only this, you can always look into newer trends which are coming up in technology. These all thoughts are possible because you have enough of time. We know that our life cycle, daily routine will not change a lot except for some hours of, not moving out of the house. But if you are not moving out of the house, move within your thoughts, move within the available space of your working, move to approach someone who needs your support, move to help someone who wants to do something good but finding it difficult to perform. So in all those ways, you will find that you are having some source of positive energy, some source of positive thoughts. And when you are thinking in positive direction, not only your health, your overall grooming will be more towards a good human being. You will be more motivated for your well-being rather than only health. Health and care both are important in everyone's life. Good health is possible by standardizing your own living pattern. Good health is possible by making yourself risk-free by following the guidelines. But good care comes when we try and understand each other in a proper way, when we understand what are the requirements of other. So think about other side as well. No matter you are only 4 members in a family or 10 members in a family, you have a lot of things to learn from each other. This is the golden period. This is the golden period of your life. You cannot just allow to go waste. So through this bus situation, get the best, collect the best, and then share the best out of you. You will find this phase is not only getting over soon, you are not losing anything. You are gaining everything every moment. Just hold on yourself for a while. This has not come as a choice. This has come as a condition which was beyond control of everyone. So if you understand this essence of timing as of now, I am sure every one of you will not only do good in your coming days, but you will excel much ahead of what you have thought in past 12 to 15 months. Every time our curriculum is giving us everything to excel, whereas these are the out of syllabus situations. So when out of syllabus situations are coming to you, your own thought process and your own caliber is more effective to overcome the situation than the curriculum what you have been taught through the past years. And I'm sure each one of you have new bundle of energy. Each one of you have a lot of potential. So don't allow it to go waste. And forget about timing. The day and night is still 24 hours. Nothing has changed except you were outside for more time. You are inside now. So try to understand your own inside. Try to understand in your, your own depth and give your best to whomsoever you are approachable, to whomsoever you are living with. This life is wonderful. And I remember एक हिंदी की मैं आपसे बात करता हूँ कि जितना अपनाओगे उतनी ही निखर जाएगी, जितना अपनाओगे उतनी ही निखर जाएगी, जिंदगी ख्वाब नहीं कि बिखर जाएगी. So have this aim in your life that whatever time is there with you, it is your own time. Do not allow to go waste. Get the best out of this time. Stay connected to each other, collaborate to each other, communicate to each other, and be the change leaders of future. This is your time. From here onwards, you are going to be out in world, and whatever you will have today is going to get multiplied in coming days. So think of well-being of yourself. Think of being the part of well-being of someone. be it your family member or not a family member, and give your best for yourself first and then to the community and country.
Thank you, sir. Thank you for the wonderful direction and guidance. So definitely as you said, this pandemic has provided an opportunity to build a strong networking in terms of media as well as relationship, where they keep on learning that networking is going to provide a physical, mental, and social well-being of a person. Next question is, initially the quarantine days were 14. Now they are said to be only 4 to 5 days. Is it true? And
See, the infectivity period was same throughout and is same today also. It's only the curative measures which are more available now. So the hospital stay has been reduced. Now, whatever is possible to treat is possible to treat at home as well. That's why this period of 14 days has been, a bit here and there. But today also, the infectivity of a virus is potent for 14 days. So if at all you have been, when I have been positive for COVID infection, follow the golden rule of 14 days. Your infectivity will be maximum in first 3 to 4 days time, and then slowly and gradually it reduces. So you will be recovering fast, but at the same time, we will not be a strong, career for the virus. So the very clear understanding has to be that whatever is there as 14 days time should stay and considered as 14 days time only.
definitely, sir. I request Mitali Kothari to present a vote of appreciation. So over to you, Mitali.
Thank you, ma'am. A warm and graceful morning to our most valued honorable chief guest, Dr. Himanshu Gupta, sir, management committee, worthy teachers, parents, and my dear friends, and everyone gathered here as well as live with us on YouTube. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked really hard to ensure the smooth working of this event. On behalf of our school, I extend a hearty vote of thanks to our chief guest, who spared time from his busiest schedule to grace the occasion. Today, we had an opportunity to hear your thoughts. Sir, your words and the way you explained and answered the doubts have left no confusion in our minds. Your thoughts have enlightened our minds and have shown us a correct path. An event like this cannot happen overnight. The wheels started rolling weeks ago. It required planning and a bird's eye for details. We have been fortunate enough to be backed by a team of very proactive and dedicated staff of our institution, Radhika Mahajan ma'am, Charushila Sagar ma'am, and other teachers who are proficient in every aspect. Special mention to our respected director Sandeep Malu sir for being the catalyst that stimulated us to do our best and standing as pillar of our strength by giving us the opportunity to get the answer to our questions during this pandemic. I would also like to thank Mitansh Dekate, who worked behind the scenes to make this event a success. Last but not the least, I want to extend my generous thanks to our wonderful listeners and to each and everyone who took initiative of sending questions. Stay safe, stay healthy. Thank you, everyone.
And I thank you, each one of you. You all were there to be in interaction through this series of questions. I'm thankful to Sandeep ji, Deepak ji, Samantha ji, and Charushila madam and Radhika madam for giving this wonderful platform to interact with the young leaders. And I'm thankful to each one of you as teachers. You have been great motivation for your students all across these pandemic times. And I'm thankful to each one of you who have a COVID warrior at your home, your father, your mother, your brother, your sister, anyone. So my highest respect to them because they have stand tall during these times. And I thank each one of you for keeping yourself focused during these days. Don't worry. Together, we can change any scenario. We all are there as a part of this country, and we have to hold high ourselves so that we can come back and bang with a new win. So let's move ahead, and I'm sure sometime we'll meet in physical presence as well. Thank you so very much, each one of you. Thanks a lot.
Thank you so much, sir. Thanks a lot.
Thank you, Dr. Saab, for taking the time out to address these young minds and motivating them to see the positivity in the adverse times. I am definite it will take them a long way in being positive through this situation till we come back to the normal times. Thank you so much, Dr. Saab.
Thanks a lot. Thank you, Bhaiya. Thanks a lot.
Thank you, sir.
Thank you.
Thank you, sir.
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 Thank you so much.
Thank you.